Should lab high total cholesterol and LDL cholesterol result in a reflexive prescription of a statin drug? I'm Dr. John Bartemus, and today's Functional Nugget will address this question. You've experienced it yourself, or you have family members that have experienced it. You go to your medical doctor, you have standard blood drawn, and on that blood test is a lipid panel, and it comes back with lab high cholesterol, lab high LDL. So your doctor says, hey, you need a statin drug. And the thinking or the reasoning behind that recommendation is that high cholesterol puts you at increased risk for a cardiovascular event such as a heart attack or stroke. Well, 20 plus years of statin drug prescription has resulted in people dying at the same rate of heart disease and stroke, just with lower cholesterol. So if cholesterol was really the cause of the heart attack and stroke, wouldn't we see a change or a decrease in the deaths from cardiovascular disease and stroke? We don't. So that begs the question, well then what is the true cause? And it also begs the question, should we determine cardiovascular risk based on lipid panel results? I equate the lipid panel to a canary in the coal mine. It is telling you there is a problem, but it's not telling you specifically what the problem is. If the canary is going off in the coal mine alerting you to carbon monoxide and you just pinch the canary's beak so it shuts up, then eventually you're going to suffer from carbon monoxide poisoning and possibly die. So if you have high cholesterol and we just dampen that high cholesterol with a statin drug instead of asking, well, what's driving the cholesterol up, then ultimately you still suffer damage or die from whatever the true cause is. And I believe that's why we're not seeing a decrease in cardiovascular events and stroke even with people on statin drugs, because the cholesterol is the canary in the coal mine. The statin drug is pinching the beak of the canary, not addressing the cause. So what is the cause? Or what are possible causes? Well, we want to look at cholesterol physiology and say, what elevates cholesterol and LDL? Well, tissue damage and inflammation will drive up cholesterol and LDL. So we have to say, okay, if this person has high cholesterol, do they have tissue damage going on or high systemic inflammation? And if so, why? Is it an inflammatory disease? Is it autoimmunity? Is it infection? Is it trauma? Have they had recent surgery? We have to dig in deeper. Or is the cholesterol elevated because they are infected? When you are infected, cholesterol elevates because cholesterol activates what are called toll-like receptors, which move the immune system to move against or be mobilized against the infection. So if you are infected and you have high cholesterol and we take a statin and dampen it, that's affecting your ability to deal with the infection and allows the infection to persist. So the nugget for today is high cholesterol should not result in a reflex prescription of a statin drug. It should result in a reflex question of what is causing the cholesterol to be high. Why is the canary screaming at me, and addressing the answer to that.